Hi everyone, welcome to our webinar today. My name is Gabriele Colosurdo. I'm the Manager of Education and Patient Services at Myeloma Canada. Today's info webinar will be on generic drugs in Canada. As many of you may know, lenalidomide or Revlimid in Canada has recently had some generic forms of it available on the market. So you'll probably have a few questions about that. And so that's the goal of this webinar, is to get some more information about that. So first and foremost, before we start, I'd like to thank our sponsors. So thank you to Apotex, Amgen, Binding Site, BMS, Dr. Reddy's, Janssen, Takeda, and Sanofi for helping us make these webinars possible. As a lot of you know, the webinars are recorded and they're all available on our YouTube channel. So youtube.com, just search for Myeloma Canada. You can subscribe to our channel. After you're subscribed, you can even click on the little bell. That'll give you notifications every time that we upload a new video. You can do the same thing on your smartphone or on your tablet. Just go to the YouTube app and search for us, and you'll be able to access all the recordings that way. You can also get to our recordings by going to our website, myeloma.ca. Click on resources, then on educational videos, and that'll take you to our YouTube channel. I also want to point out we have educational publications on our website as well. A lot of the information that we're going to discuss today during the webinar is provided in a handout that we made, our new, it's called an info sheet. So you can find that info sheet in our educational publication section so that'll be just like a paper version of what we have here. So last but not least, how to ask questions. So I ask that as the questions come to your mind, please type them in the questions function on your GoToWebinar software. Whether if you have an iPad or a smartphone, it's the same principle. You click on questions, you type in your question, you press send. I'll receive the questions. I'll ask our presenter at the end, to answer these questions for us. So without further ado, I'd like to introduce to you Mena Kinal, who is a pharmacist at Pharmacie Michael Assaraf in Montreal. Mena, thank you so much for doing this for us, taking the time to do this for us.
It's my pleasure. So hello everyone. As mentioned, we're going to be talking about the new generic version of Revlimid that's available in Canada. Oh, hold on, sorry. I'm just trying to change the slide. Okay. So because generic options are now available, your healthcare team may have recently spoken to you about switching to a generic version of Revlimid called lenalidomide. As of September 1st, 2021, new generic versions of lenalidomide capsules, commonly used to treat multiple myeloma, were approved. Once the generic is added to the provincial drug formulary, both provincial and most private insurance plans will no longer cover the cost of the brand name medication, of course, due to the price difference between the generic and the brand name. Oops. So because I practice in Quebec, I just have a little area here for all the Quebec patients taking Revlimid. So as of November 10th, RAMQ and most private insurance plans no longer cover the cost of the brand name medication. In addition, financial aid that was provided by the RevAid program is no longer available. So if you are under the RAMQ drug plan, you will have to pay your contribution that comes up at each month. On average, it's between $55 and $96. Also for private insurance plans, there are also contributions, usually in the range of 10% to 20% of the drug cost. So what are generic drugs? So they're pharmaceutically equivalent copies of the brand name drugs. Compared to their brand name counterparts, generic drugs are created to have no significant difference in terms of safety and efficacy, mode of administration, quality, and expected behavior in the body. They contain identical medicinal ingredients or ingredient, and they may have different non-medicinal ingredients. So what that means is the color of the capsule can be different, or the ingredients used to make the capsule can be different as well. But the active ingredient itself is identical. To be available in Canada for sale, a generic drug must be approved for sale first by Health Canada and must demonstrate bioequivalence to its brand name counterpart. Sorry. Bioequivalence means that there is no significant difference between the generic and brand name drug in how quickly the medicinal ingredient is absorbed, how quickly the medicinal ingredient reaches a certain level in the blood, and how the generic drug itself acts in the body. So generics are just as safe and effective as their brand name counterparts. The innovative brand name drugs are usually protected by national and international patents, as well as data protection requirements. So there's a period of market exclusivity where just they are allowed to sell their medication because they have the patent on it. Generic drugs can only be sold after those protections expire or the patents expire. More than one generic version of the same brand name drug can be made. So in the case of Revlimid, there are several generic versions of the lenalidomide. How are generic drugs tested and how are they reviewed? Companies who have created a generic drug and want to sell it in Canada must complete a generic drug submission for review by Health Canada. Generic companies conduct studies with human volunteers to ensure that the pharmaceutical bioequivalence of the generic drug to its brand name version are met. Two drugs are taken by different groups of people at the same dose and in the same way. For each group, levels of the medicinal ingredient in the blood are measured at specific time points to calculate the drug's bioavailability, meaning how much of the drug actually got into the blood. Generic drug submissions go through a very similar review process as brand name drug submissions, and they do so through Health Products and Food Branch of Health Canada. The HPFB review process includes a thorough evaluation of the submitted information and may sometimes include external consultants and advisory committees. They evaluate the safety, efficacy, and quality of the data. They also review information about the drug that will be provided to your healthcare practitioners and their patients. So what's on the drug label and what's on the product brochure. So what happens if you happen to react differently to the generic drug? It is possible, although very rare. If you experience any allergies, sensitivities, side effects, let your healthcare provider know that you were switched to a generic drug and that you are reacting to it differently than you did to the brand name version. Together, you can talk about your options and what medication is right for you. Even though there are generic drugs now on the market, the brand name drug is usually still on the market as well, as it is with Revlimid. Prior to taking any prescribed drug, whether it's a brand name or a generic, speak to your healthcare provider about expecting side effects and how to manage them, what to look out for, and what to do and when to go to your nearest emergency room. So I wanted to talk a little bit about our pharmacy. What we do is we have our expertise in specialty medications like Revlimid or lenalidomide. And our pharmacy provides several services to ensure that you can achieve the best possible results from your therapy. These services include direct access to a team of 10 pharmacists, collaboration with your healthcare team, follow-up and management of your therapy and side effects, lab test result monitoring to ensure safe and effective therapy, support with insurance issues, which can happen, and quick and reliable home delivery. So that's it for the presentation. And now we're going to go on to the questions.
Thanks a lot, Mena, for that. That was for going over all of the information. And so we did get quite a few questions that came in. So I'll start with this one. So we talked a little bit at the end about side effects now and what to do in case someone were to experience any side effects. In cases like that, let's say there is a severe side effect. Can that person have access to the brand name drug? Is there a scenario where they can regain access to the brand name drug, without paying a fee?
Yes, so it definitely can happen. Now, the procedure is, I'm not too familiar with it. Sometimes they will require you to try another generic of the medication because it's most likely an allergy due to the non-medicinal ingredient, okay? Because those are the ones that are different. So they might ask you to try another one. But the doctor can, under certain circumstances, especially if it's severe, request a non-substitution so that the patient can continue to go on the Revlimid.
And so that would be something like, you're speaking for Quebec only, and it's possible that the situation is different in other provinces.
I think in Ontario, because I went to school in Ontario actually for pharmacy, so I remember a little bit of the rules. I think I do believe it's the same concept. I can't speak to other provinces though.
Okay, thank you so much.
No problem.
So sticking with the I guess the side effects. In terms of, you had mentioned that perhaps that side effects could be due to the fillers or the whatever is other than the active ingredient that's in the medication. When you compare those types of side effects to side effects you would experience with, let's say, someone who is switching from a generic drug such as Advil to generic Advil, or any other drug that you're doing the switch, are those side effects similar in nature?
Yes, so because, it wouldn't be a side effect to the medication itself, right? It wouldn't be a reaction to the Advil or to the Revlimid chemical. It'd be a reaction to sort of the binders that are used, fillers, the colors that are also used to make the pills. So the nature of the reaction would be different than the reaction you would get to the actual medication. Usually they're similar. It can resemble more of like an allergic reaction. Okay, so that's what I've read and heard, but everybody's different. So, if a patient experiences anything different when they start this medication, no matter what it is, they should always let their doctor know. Or their pharmacist.
Or the pharmacist, yeah.
Yeah.
We often forget to say that, or ask your pharmacist, but it's true.
Yeah.
The pharmacists provide a lot of services that can benefit people who are living with chronic conditions. Yeah.
Exactly. We know our medications.
Exactly. So the next question, I guess, let's stick to this whole, so generics. So these generics have been approved in Canada, right? It's not just in Quebec, it's all of Canada. Do you know how many different versions there are? Let's start with Quebec. How many different versions are in Quebec? And then maybe if you have information about other provinces.
So there are, I know, I don't know all of them. There are 4. So there's Natco, there's Apotex, we have Dr. Reddy, and Sandoz. Yeah, and a lot of them, so I know that Sandoz and Natco are still part of the Rev Aid program. Okay, the other two have their own programs.
Mhm. And the switching of the program is done automatically at the pharmacy when someone.
Uh, no, so the patient will be registered, I believe, by their healthcare providers. The pharmacy, if they're going to dispense that type of generic, they'll have to be enrolled with that specific program.
Okay, cool. Thank you.
No problem.
So the next question I have here. So we said, okay, there's four. How many? Okay. So we talked a lot about how at the beginning on how the testing is done by who's the testing done by? It's Health Canada that does the testing, or is it data that the company will provide to Health Canada?
Well, it's data that that the company provides to Health Canada.
Mhm.
So they have this drug review submission, and it's a lengthy document. There are a lot of tests that need to be done, and then they do all those tests, get all that data together, submit it to Health Canada. They review it, and they decide whether they think it's good to be put onto the market or not.
Great. And this data, is it information that's made available publicly by Health Canada? Do you know where someone would, example, be able to access that information?
I'd have to look into that. But I do believe on the Health Canada website, you are able to see drug submission reviews. How to access it on the website, I do not know, but I do know that you can.
Great, thank you. So, I mean, if anybody has any questions, we can try to locate
Mhm,
that stuff for
mhm.
you.
Oh, yeah, absolutely. I can look into it.
Yeah, thank you. Okay, so that we did that question. We did that question. So in terms of when you switch from a generic from a brand name to a generic drug, because of those switches, we talked about the side effects. We talked about how it could be allergic reactions. Are there certain conditions where you would be predisposed to having more side effects when making a switch because of yeah,
I don't,
like for
I don't
example, someone
believe,
has
yeah,
bleeding disorders, let's just say, as an
I, I,
example.
I I don't believe so. If someone has, well, if a person just naturally has a lot of allergies to, chemicals, to foods, to everything, there's always an increased risk that they will have a reaction, but
Mhm.
also to anything else, not necessarily just that. Also, keep in mind, some of the non-medicinal ingredients are actually not different. So it depends. No, I can't speak to lenalidomide, but I know that some generic drugs, there's absolutely nothing different. Um, the non-medicinal ingredients are also the same. So um, for that, you would have to compare ingredients and see if it's the same. But so to go back to the question, sorry, I sort of
Mhm.
diverged a little bit. If you're predisposed to having a lot of allergies, you're particularly sensitive to anything new. Of course, I would say that maybe you'd be more predisposed to it, but I, that's everybody's different, so I wouldn't be able to tell you yes or no. Mhm.
Thank you. Um, we talked a little bit quickly about at the beginning of the presentation about how for those people who live in Quebec that are part of the RAMQ, the
Mhm.
local health program here, they have a fee now
Mhm.
to pay every month. And that was because originally the fee was covered for the generic, for the fee was always there, right?
Mhm. Yeah, exactly.
The fee was always there. It was just it was covered by the brand name company. Uh,
Exactly.
okay,
Yeah,
and so do
yeah.
you know if that's in Quebec? Do you know if other provinces are experiencing the same thing?
I don't know. So all I know is in Quebec, we're no longer allowed to accept financial aid from pharmaceutical companies and their patient support programs.
Hmm.
Um, there are some exceptions, for example, biologics, but I'm not going to get into that. But I can tell you that for this medication, it is no longer allowed. unfortunately. I don't know about the other provinces. Again, that will be up to each province.
Yeah, I mean,
To
I
decide,
guess
yeah.
ask your pharmacist.
Exactly. Ask your
In your
pharmacist. They'll
province.
know.
Yeah,
They'll know. Yeah. Yeah.
accurate information. Yeah, so I think we pretty much went through all the questions that I got here. There's some that are I still have some, but they're more specific to the province themselves. So I really
Okay.
urge
Sorry, I
this.
can't answer that.
Yeah, so I really urge this person to speak to their pharmacist about these questions. And again, yes, I do see. Yes, so someone's looking for the data on the Health Canada website. So I'll put myself a note over here to contact this person and send a link. Okay, perfect. So with that, thank you, thank you, Mena, for the presentation. It was great. This is maybe on our YouTube channel, so anybody who's looking for more information can find it there. So thanks a
Great.
lot. Have a great day.
You're very welcome. It was my pleasure. Take care. Thank
Take
you.
care. Bye.
Bye.